room scan. And then just the mark and the page.
And then I would normally wear scrubs, but for practicing purposes, I just have regular clothes on. Alright, so first today I'm going to be giving ketorolac. So the lab value I would be looking at for this is the kidney labs, which is BUN and creatinine, which they're both in normal range today, so I'm able to give ketorolac. I would go to the patient, I'd say, hi, I'm Maddie. Are you in a comfortable position? And then I would ask them 3 questions. The 3 questions I would ask is for flu zone, I would ask if they are allergic to eggs. For morphine and ketorolac, I would ask if they're feeling any pain and when was the last time they received the medicine. Then I would do the pain assessment. So I'd ask if they're feeling any pain, and I would ask on a scale of 0 to 10 what their pain level is. So after I do that, I'm going to do the landmarks and the 3 sites for IM. The first one is the deltoid acromion process. The second one is the vastus lateralis greater trochanter, which is the hip, which is what we're doing today. We're doing this location today because it has best absorption for this medicine. And then the ventrolateral greater trochanter, which is more on the butt. And then the lateral femoral condyle. And then the anterior superior iliac crest, and then the iliac spine. So now that I did all of those, I would hold any medications with my nursing sound judgment, which I don't feel the need to today. I'm going to go to my MAR and my provider orders. I'm going to find ketorolac. And I'm just going to compare the MAR and the provider orders. So I have Joseph Smith, ketorolac, or Toradol. I have 30 milligrams IM every 6 hours PRN for moderate to severe pain. The medication has not been yet given today. So everything's checked for that. Now that that's checked, I'm going to take the provider orders and put them away. So I only have my MAR and my 1-pager out. So that I'm going to gather my necessary equipment, which is in the drawer, and I'm going to check the integrity of my packages. They would be closed, but for practicing purposes, I have them open. They have good integrity. And then for the needle today, I'm going to be using a 22 gauge, 1.5 inch. So I'm just going to set these over here. And then back here, I'm going to I'm going to ask the patient, do they have a preference on hip? Today we'll be using the right hip, and they are able to get the injection today. Since they haven't gotten it yet, they're good to go. And then I will start with my first check. So I'm going to get the medication out of my cart. I would double check with the instructor to make sure it's the right medicine. So comparing with my MAR, I have Joseph Smith. I have ketorolac or Toradol, 30 milligrams IM every 6 hours PRN for moderate to severe pain. Joseph has not yet gotten it today. For the vials, for the single dose, I would just check the expiration date. For the multi-dose, I would check the date opened and the expiration date. If it's unopened, I would open it, write the date, time, and my initials, and then the expiration date. I can't remember if I said that. And then I would look inside the vial just to see if anything's floating, check the integrity of the vial, which everything looks good. So then I have my first check done. I'm going to move to my second check. Again, I have Joseph Smith, ketorolac or Toradol, 30 milligrams IM every 6 hours PRN for moderate to severe pain. It has not been yet given today. And then again, for the single dose, I would check the expiration date. For the multi-dose, I would check the expiration date and the date opened, as it can only be open for 28 days. I can't remember if I said that in the first one, but in the first one it can only be open for 28. If this is the first time opening it, I would write the date, time, and initials on it, and I would check the expiration date. I'm going to inspect inside for the integrity of anything floating, which I don't see anything, so it looks good. So then I'm going to go to the patient's bedside for the third med check. Just going to organize my stuff. So I'm going to enter the patient's room. So knock knock, hi, I'm Maddie, I'm your student nurse today. Can you tell me your name and date of birth? I'm going to look at your wristband. All right, I'm going to provide for privacy, perform hand hygiene. Do you have any allergies? I'm going to check your allergy band. For PPE today, I need gloves. I'm gonna put those on now. Today, the provider ordered a ketorolac injection for pain at the vastus lateralis greater trochanter, which is your hip. This is best absorption with this medication. So that's where we're putting it, okay? I'm just going to assess a few things, ask you some questions, teach you about the medicine, and then I will be able to inject it. Do you have any concerns before we begin? Okay. I'm going to do my third med check quick. So I have Joseph Smith, ketorolac, or Toradol, 30 milligrams IM every 6 hours, PRN for moderate to severe pain. I did not say this for each of the 3 med checks, but I'm calculating the dose. Today we're doing 1 milliliter, just for practicing purposes, since we don't have an instructor telling us. So I would calculate the doses out to get the right amount of milliliters, but so I said IM every 6 hours, PRN for moderate to severe pain. So I would check with the instructor again to make sure it's the right medicine. And that's done. And then again, during the third check, I would tell the patient again, we're doing the vastus lateralis greater trochanter, which is the hip, the right hip today. This is best for absorption. So I'm going to teach you a little bit about medication. The action of ketorolac is it is an anti-inflammatory that treats mild to moderate pain and reduces inflammation. Some side effects are dizziness and drowsiness. Do you have any concerns before we begin? And since you don't, I'm going to have you teach back the medicine for me. Good. All right. I'm going to put this away. And now I can get started on getting everything ready. So I'm going to take an alcohol prep pad, circular motion, clean the top of the vial. I would pop the lid off. Okay, let that dry. I'm gonna get my needles ready. I'm gonna stay sterile, and I'm going to unscrew this, keep the needle in, put this one on, and then I'm going to pull back 1 milliliter of air, since I'm going to be giving 1 milliliter of ketorolac. Going to pull this off, set it down, and I'm going to hold this and inject. I'm going to inject the air to the medicine, flip upside down, and pull back. 1 milliliter. Getting the bubble out. Okay. I would have the instructor check right now to make sure it's the right amount, the right dose. So now that I have the 1 milliliter, I'm going to flip it back and all the bubbles are out. Going to pull out, set this to the side. I will be doing the scoop method. Going to take this, screw it off. Screw this on. So now that I have this, I'm just going to set it here. So now I'm going to position the client comfortably so they can relax. Again, we're doing the vastus lateralis greater trochanter. So I'm just going to feel around. I'm actually going to move him this way. And Joe is able to relax. So I'm feeling for the greater trochanter so my palm can go there. And I'm going to keep this here. I'm going to taut the skin back, so pull it down. I'm going to grab my alcohol pad. I'm going to cleanse in a circular motion for 30 seconds. And then I will put this there for a little marker on where I cleaned. I will let this dry for 30 seconds. And while that is happening, I'm going to hold this like a dart at a 90-degree angle. The skin is dry now, so I'm going to put it in slowly. And I want to inject it about 10 seconds per milliliter, so I'm going to put it in really slow. Once it's in, I'm going to hold it for another 10 seconds. And I'm going to pull it out. I would put a 2x2 gauze down. I'm going to do the scoop method. I would put this up and put it in a sharps container, but for practicing purposes, I'm just going to do the scoop method. Now that I'm putting pressure on the gauze, I would assess the site and put a band-aid on if needed. I will take my gloves off. I'm going to chart on the MAR. Good. Perform hand hygiene. I charted on the MAR and I would report per agency policy. I will be back to reassess the patient in 10 to 30 minutes. I will be assessing the site. For any adverse effects, I would withhold further doses, do the vital signs, document, contact the prescriber, and contact the pharmacy. Once that's done, I'm going to ask, do you need anything else before I go? They'd say no. I'd make sure the bed's low and locked, the side rails are secure, the table is near, the room is risk-free of falls, and the call light's within reach. I'm going to gather and cleanse all my equipment to clean and take out. And then, now that that's all cleaned up, perform hand hygiene. The 5 moments are before touching a patient, after touching a patient, before a procedure, when touching a patient's belongings, and when touching bodily fluids. I will now go chart per agency policy, norms and deviations, and I will go document my findings. Thank you.